The deaf community have decried marginalization in sexual and reproductive health and rights (SRHR) information in improving their health and general well-being. According to the community, majority of the deaf have no access to SRHR information owing to lack of understanding and knowledge of sign language among healthcare workers. They argued, has led to a communication barrier between them and the healthcare professionals, making access to quality SRHR a mirage for them. Alice Diana tells us more.
The government and the media have been urged to break communication barriers to make provision of sexual and reproductive health and rights services more inclusive of deaf and more so the young people. Speaking during a sensitization workshop in Embu County, themed leveraging the media to promote sexual and reproductive health and rights for young deaf adolescents, Deaf Empowerment Society of Kenya official Jacob Mugambi noted that without a translator, healthcare providers are unable to inform deaf patients about different sexual and reproductive health services.
We are requesting you also to advocate for the rights of the deaf people, because the government is focusing with simple languages for the hearing and the blind, but spoken language, but they don't involve the deaf people. We avoid the deaf people, so we want deaf people to be equal, to get equal services of sex, reproductive health. So we are here to advocate for the deaf and the government to support the deaf community to be included in the line of sex, reproductive health rights.
He also raised concern over parents being ill-equipped or not knowing how to share health messages to their deaf adolescents and the youth, limiting their access to this critical information and care. This, he said, had perpetuated discrimination and limited access to healthcare, which could only be reversed by giving them more access to health learning opportunities.
When we are talking about sex and reproductive health, the deaf people should be fully involved and be aware of what is needed. So when parents of the deaf know more about this information about sex and reproductive health, the deaf people will be aware about that. So the media should advocate for us so that the parents should teach the deaf, very young deaf adult to know more about sex reproductive health, and they know their rights.
They noted that most healthcare workers lack basic science and understanding of specific science relevant to sexual and reproductive health, making it hard for them to get these services in hospitals.
People view us differently. Sometimes if maybe, for example, I get pregnant and then I go to the hospital, in the hospital people will view us as maybe, for example, I need service for pregnancy, and then the doctors will not serve us. It is the big problem is communication, whereby the nurse will look at us and they will be worried because they don't know how to communicate to us. So they don't value having the best way of communicating to us. So they will talk to us, but we can't answer or say anything on what they are talking to us. So we have a lot of barriers. That is why we are not involved mostly in the reproductive issues.
The deaf community is now calling on the media and app developers to come up with user-friendly messages and applications on sexual and reproductive health information for them to bridge the knowledge gap. Additionally, the members also noted that sign language interpreter space on TV is too small to be seen well, hindering access to information.
Like the media, also to have some apps on sign language, not only about interpreters, but apps which can help some doctors or nurses to learn sign language so that we can access those information. The media can partner with desk and collect more information about persons with disability, especially the deaf people around Kenya. Also, the media can improve the area of services where maybe, for example, we have the TV, we have the insertion of interpreters. They can expand that insertion. Why? Because most of the time, the deaf people cannot see that insertion of the interpreter very well. So the interpreter is very tiny at the insertion. So Sometimes the deaf people have to learn from the media and empower themselves. So the government should advocate and get more information by developing the deaf community.
Alice Diana, Hope TV News Watch.